I am here today with Miss Shayla Brown of Genesis Birthing and Living. She is a virtual doula and has been doing this work since 2014, trained by the International Center for Traditional Childbearing, or the ICTC, which is now known as the Shafia Monroe Consulting. Ms. Brown has been an advocate against unnecessary C-sections for Black women, which we'll be talking about a little later on, and her blog and platform seeks to educate and uplift Black women as birthers and mothers. You can follow her and her family's journey as well for educational programs at Birthing Genesis, Genesis Birthing and Living, goodness, and on Instagram, YouTube, and Facebook. Thank you so much for being here, Miss Shayla. I appreciate you.
No problem. Thank you for having me. I'm always excited to talk about birth. So.
All right. So I'm gonna go ahead and start off with my first question.
Okay.
Some of these are a little bit. Did she edit my? I'm so sorry. But here we go. So, how can having a doula or alternative birth assistant improve mental stress in Black women? And how have you seen it help the Black women in your practice?
Okay. So I made some notes. That's probably what you're looking at.
Oh, I'm sorry.
Okay. So one thing is anxiety. Anxiety is a huge thing for. It's becoming more known now. You know, the Black women experience anxiety. A lot of us have experienced it all our life, and we didn't know what it was. So there can be a lot of anxiety attached to just not knowing what's next in the process or how a process is going to go, particularly for Black women, because when we look up birth, all we see are horror stories. So it can create a lot of anxiety when you're going into the process, and everything you look up is talking about you dying. So having a doula kind of can help you to navigate the process where you know what to expect. Some of your fears, you can bring them to an actual person whose only job is to take those fears and help you to quell them so that you can go into the process knowledgeable. And especially again for Black women, because again, whenever we talk to our communities, a lot of times the stories are so bad that creates anxiety too. And it can also create some depression because you can end up doing it alone because it was so traumatic for your mom or your sister or your grandmother, whoever, and they don't want to talk about it. They don't want to join you in the process. So we end up doing it alone a lot of times. And I've supported a lot of women who've done birth alone because I feel it's because their foremothers' experiences were so traumatic. So it gives you just a friend, a sister throughout the process, which is the unique thing for Black women, which is why it's so important to have a cultural competence in doula care, because we tend to, like I said, have that specific problem going into birth alone. So you kind of need someone who's going to go along with you as a sister, as a friend, not just as a knowledgeable expert, but somebody who's kind of there to support you mentally and emotionally as well. So it helps you to curate tools to create a desire process. You know, we obsess about our weddings and about our graduations and about our careers, but we don't tend to do that with birth. So we just kind of go in and getting whatever you get. So having a doula can help you to think about, what do I want to get out of this? How do I want it to go? How do I want to feel? What do I want the room to look like, smell like? And it can be a joyous occasion. And a stress-free occasion, a happy occasion, and that can help to ease mental stress and to build mental delight, even thinking about it and going into it and thinking back on it after it's over. And also just going into hospitals with the fear of not coming back out because of how we're treating hospitals, or just going, even if you don't have that fear going into it and you don't know that that's going to happen, when we go into hospitals, we're treated so badly that stresses us so much that it makes the process just hard to do. It's hard to be in labor and fight with your medical professionals at the same time. So your doula is kind of that person who does that for you. And sometimes, in my experience, just having a doula changes the way that medical professionals approach you, because they know there's some accountability attached to this patient. So they have to approach you a lot differently, with more respect and with more kindness.
Absolutely. Thank you so much. I'm moving on to our second question now. At what point should families begin looking for a doula to support them on their pregnancy birthing journey? Sometimes it can be difficult to find the right provider just in terms of like looking for doctors, pediatricians, OBGYNs. So what are some things to keep in mind when looking for a doula?
So definitely you should start looking for a doula as soon as you know you want to become a parent. As soon as families know they want to become a parent, you should start looking for doulas. The same way if as soon as you knew you wanted to get married. We don't always have to be engaged before we start looking at wedding photos and wedding.
Right.
So pretty much the same thing. As soon as you know, okay, one day I want to be a parent, whether that's when you get married or before, you should be looking for doulas and you should be researching doula support. And some of the things to look for is cultural competence. I always encourage Black women should just be looking for Black doulas. Research shows that we have better outcomes when we have medical professionals who are us, and that a leading cause of distress attached to pregnancy is working with white healthcare providers or just non-Black healthcare providers. Because again, have been articles and things written saying that Black women are not always believed when it comes to pain or when it comes to our bodies. And the system is just so racist that it's almost like white providers can't really help themselves. And they just see Black women in a lens that's not flattering, that is not credible as far as what they're feeling, what they're thinking, and what they desire. So you need somebody who sees you as credible, and that's going to be another Black person. But of course, just being Black is not enough. You got to also think about other cultural things, like what are your religious views? You want to find somebody who shares those views. Economic backgrounds. I supported a lot of women in South Phoenix Healthy Start. It was a different economic background than when I supported women in my private doula practice. So, and the desires were different, the dynamics were different. So you're gonna want to think about somebody who maybe comes from, or at least understands, or at least has supported whatever your economic background is. Um, Values, any values you hold, marital status. You might want a doula who's married if you're married, or if you're not married, maybe somebody who's a single mother if you're gonna be a single mother, who just can understand you as much as possible. Um, Number of children they birth themselves, looking for their personal experience with birth. I personally think the best birth workers have had personal experience with birth, whether it was loss, miscarriage, or infant loss, or stillbirth, or whether they birth 5, 2, 3 children. The best ones have had some kind of personal experience with birth themselves. And then pretty much just evaluate yourself. Write down as much stuff about you as possible, and then find somebody who matches the things that are most important to you about you, if that makes sense.
Right.
Yeah. So, oh, and of course, you want to look for knowledge of the type of birth you want, because you can birth in different ways. If you want to birth with an epidural, what kind of knowledge does she have about epidural birth? Who has she supported primarily? Like me, I am a natural birth advocate, so I prefer clients who want natural births because that's where my expertise is. That's where my beliefs are. So it's a lot harder for me to support clients through medicated births because I don't care for them, to be completely honest. So you want to find someone.
I said reasonably so.
Yeah. So you just want to find somebody who wants to give you the birth that you want, and then just I think that's and then you want to ask about their philosophy of birth. Like, what do they think? What is their philosophy around birthing and laboring?
Right. So thank you. You definitely also kind of touched on my next question about community health workers and how they have significant impacts on physical and mental health when those relationships are, at their best. And so I guess, during the whole pandemic, I wanted to know, what does it look like to virtually support clients right now, like during this age that we're in?
It's a little difficult because again, culturally, we as a people tend to be more hands-on, more, we like to taste, touch, see, smell people, and virtual is detached. But luckily the world is moving into virtual things, so people's mindsets are changing about it, and with the pandemic, we kind of don't have a choice. But one good thing is that Another thing I advocate besides or alongside natural birth is partner support. So it gives partners a chance to really shine right now. So the most your doula might be able to do is maybe educate you all. So she can educate the two of you and educate your partner to be your doula pretty much. Educate your husband to support you in labor. When he gets as much knowledge as you have, because historically a lot of times dads they're there, you know, kind of, and then some of them, depending on the dad, want to be more hands-on, some want to not be. But I think with the pandemic, it's taken away a lot of that option, and dads have to be more vigilant. They have to be more involved. So a doula could train both of you to go into labor together, and where the dad can be the protector and the supporter and the knowledgeable advocate throughout the birth experience. So.
Right. Thank you. So moving on again, a lot of your work focuses on informing Black women on the harsh reality of C-sections and why we should avoid them. And I'm not gonna lie, when I was scrolling through your Instagram myself personally, I was kind of shocked at some of the things that I saw. Those were news to me. So what are some things that happen during and after C-sections that most Black women aren't aware of currently? Like some of those lesser known facts about C-sections.
Okay. Well, first of all, C-section is surgical birth, so it's not the same as a vaginal birth. A lot of times it's sold as, well, you know, it's not a big deal. You go in, you're cut open, the baby comes out, and you're good. But it's a major surgery opposed to a minor surgery. So a major surgery, by definition, just means that your risk of death is higher. That is literally the definition. You can look it up on Webster or whatever. Your risk of dying is higher. So first of all, it's major surgery. And you have minor surgeries like mole removal or something like that. But since we're opening up a major cavity, your abdomen, and going into layers of skin, layers of fat, layers of tissue, it's major. So there's that. Your risk of dying is higher because of the type of surgery it is. It is surgery. It increases your risk of hemorrhaging, of course, because you're being cut open, you're bleeding more. It increases your risk of your baby's risk of being lacerated throughout the process. So you might have seen some pictures.
Lacerated?
Yeah, I'm sorry, cut open. Like,
Oh,
yeah, like
yeah.
I have some pictures on that same Instagram feed of babies who pieces of their scalp have been cut off during the procedure, or they come out with lacerations or scars under their eye or their cheek or in their head. So that's a risk that increases. Of course, you have to use more drugs when you're doing a C-section because there's no way to cut you open without anesthetizing you. There's a risk of having an adverse reaction to anesthesia. One of the women who have died in 2020 here, she Asia Washington. I think I'm saying her name right. Forgive me if I'm not, but it's she Asia. She died of well, really, she had an anesthesia overdose from the epidural. So you have to get the epidural if you're getting a C-section, and women can overdose on it. Another thing that commonly leads to maternal death related to C-sections is you're being cut open, so other organs are at risk for being, pushed to the side or damaged. What is her name? Kira, I think it's Kira. I can't think of her last name, but anyways, her husband is an advocate for birth now, for Care for Moms. He's on Instagram, but she died from her bladder was nicked or cut during C-section, and that's a risk, and she bled to death that way. So you can have other parts of you that are cut throughout the surgery that amputation. You could end up amputated if you lose too much blood during the surgery. That happens pretty often, actually. Women go in to have their baby, they have a C-section, and they leave with no legs, or they leave with no feet, or they leave with no hands because they lost too much blood in the surgery. You can, a pulmonary embolism, where blood clots form in your legs, and they travel to your lungs, they put strain on your heart, and now you have a heart attack. Countless Black women have died that way from complications with C-sections, and sometimes it doesn't happen until after you've had the surgery, you go home, and then you die of complications.
Right.
for the C-section. And that happens often. That almost happened to Serena Williams. She just happened to have a history of blood clots, so she knew the signs, and still she had to advocate for herself pretty hard for them to even take her seriously. Let's see, you have the risk of placental attachment issues in further pregnancies. The next pregnancy, now your placenta might attach across your cervix. That's called placenta accreta, and the baby can't come out because your placenta is blocking the vaginal pathway. So now you have to have another C-section. There's an increased risk of placenta accreta, where your placenta attaches too tightly to your uterine wall, and you have to have surgery to get to have the baby delivered, because now your placenta has to surgically be removed. And that is an increased risk of a lot of blood loss as well. Make sure I'm not leaving anything out. Of course, just recovering from a C-section is hard because it is major surgery. And so now you have to recover and go home and try to take care of a newborn with a huge, scar in your uterus, and you're bleeding and you're trying to heal yourself, but you also have to nurse. Breastfeeding is harder once you have a C-section because the hormonal triggers are not regulated the same way that they are when you have a vaginal birth, and when your body is releasing a baby through the vaginal canal. Your body is not quite sure that a baby came out, so the hormones are not released in the same way, so breastfeeding is harder. And then just adverse reactions to the anesthesia could, if they don't kill you, you could end up really sick the next couple of days. And that's hard to take care of newborn. If you want to breastfeed, you can't because you're kind of out of it, and somebody else had to take care of your baby for a while. So those are just some things that I think women don't know and that doctors don't communicate when they're suggesting C-sections.
Right. That is an exhaustive list of what can possibly go wrong, especially for Black women when we're being mostly ignored. Wow. Thank you for all of that, because some of that I really did not know. So I want to go into a little bit of a lighter note. Last question.
Okay.
So this is for, I forgot to mention earlier that this is for our Ask a Mama Doc series, and you are a mama, and you have had I thought it was 4 or 5 successful, unassisted home births or free births, and I know they were all different. And you just had a baby. Congratulations.
Thank you.
So I wanted to know, how do you see so basically, what do you think of unassisted home births and their impact on Black women's ability to overcome many of the challenges that you just listed, or just all the other challenges outside of a C-section? How we can improve on those and overcome those overall, during and after pregnancy.
Okay. So 2 of my births were unassisted. The other 3 were natural. One was in a hospital, and the other 2 I had midwives at home. Okay. So I've had home births with midwives, home birth with nobody but me and my husband, which is unassisted, and then I had a nurse midwife in the hospital.
Okay. Thank you.
So a few ways. One, just the confidence of knowing that birth is natural. The confidence and the comfort of knowing that it's a natural process. It's not really anything to fear. Things can go wrong, yes, but primarily that should not be the focus when birth happens. And so when you have home birth, you have people, and you have a midwife. Your midwife tends to come from that same perspective. And so a lot of the fear-driven, fear-based birth ideology that you get in the hospital, particularly as a Black woman, you don't get that in a home birth setting, because everybody's kind of on the same page, and there's just a more calm. You build more of a relationship with your provider when you have a midwife. Your appointments tend to be an hour or 2 hours long, opposed to 30, 45 minutes in a hospital setting, and your provider isn't really giving you information on the process. They're just kind of dictating to you what they're going to do to you and what should be done. When you have a home birth with midwives, they really educate you about what's happening with their body. They allow you to ask as many questions as you want. They tend to get to know your family. If especially in home birth settings, a lot of midwives will come to you. So you're at home, you're comfortable, they're coming into your space. It's kind of like on your territory, your turf, your terms. So there's that stress of your provider dictating to you and belittling you and not listening to you. That is gone a lot when you have home births. The pushing for drugs, that doesn't happen because midwives don't tend to carry a lot of drugs. The let's see, that's probably the hugest thing, the education and how you're treated as a person. That is just so much better when you have a home birth. And when you have a positive experience. So like, it was hard for me to even believe a lot of the trauma that Black women were experiencing in hospitals, because I had such a good experience with my first and second pregnancies. I just didn't believe it, to be honest. I'm like, are people really having to go through this as they have babies? And the answer is yes, but I was so far removed from it because I had such a great experience that it was just hard to believe. And so if that can be more of the narrative, then when our granddaughters come along and our daughter-in-laws and our sisters and they want to know about birth, we have a more of a positive, uplifting message to give them, opposed to fear and distrust and worry and fret. So
Certainly, I believe that the birthing experience for Black women should be more personal, as you described, where it's like we're in control of the experience, like whether it takes place at home or whether it takes place in a hospital. That kind of connection, those kinds of boundaries have been set where we're safe, we're protected, and everything's kosher, you know?
Yeah. And I think too, it becomes more a part of the culture around womanhood. Now I feel like everything is included in womanhood except like birth. And when birth comes up, it's the one part of motherhood where we are told that we're not knowledgeable enough about what's going to happen in our bodies to actively be participants. We kind of have to sit on the sidelines as we have birth, opposed to when nobody else is getting married for us. You know, nobody else is getting their hair done for us. Nobody else is getting their nails done for, like, we get our own nails done. We take our nails to the salon. We say, I want this color, and then that happens. You know what I'm saying? Yeah. But with birth, we take our bodies to the hospital, and they're like, this is what's gonna happen to you.
Shouldn't be that way.
Right. It shouldn't be that way. So that's definitely something that is remedied by having home births and in home birth settings.
Awesome. Well, thank you so much for your time and sharing all your information and knowledge with me today. Black Mama thanks you. I thank you. So I will pause the video.
Okay.
All righty.